A variant that's wreaking havoc in India is in Canada. British Columbia says there have been 39 cases there since April 4th, and there's one case in Quebec. The variant was first detected in India, which has the world's fastest pace of spreading infections and the highest daily increase in case numbers. In fact, more than 314,000 new COVID-19 infections were recorded in that country in just the last 24 hours. The variant has a double mutation on the spike protein gene and appears to be more transmissible, but it's not known if it causes more severe disease. We asked infectious disease specialist Dr. Jane Chagla to explain why the new variant is being called the double mutant variant and if it's a serious concern for Canadians.
The double mutant is because there are two of these mutations within the same virus. The question that still hasn't been answered, does that really make it more than just one of these mutations? Like, is it double as bad, or is the combination of these two mutations not really add much than one of these mutations by itself? Obviously, we're seeing this overrepresented in India, which often does give us a first sense that it is transmitting faster than other variants that are out there in India. But, again, the implications, is it 20%? Is it 30%? Is it 50%? The UK variant was estimated up to 50 to 60%. We still don't know, what that really means as compared to other variants out there. So, yeah, it's still not clear whether or not the issue is just the sheer numbers, or is it, something else biologically that's making people much more sick. And I think that's, again, something we'll find out in the next few weeks. The combination of the two mutations, we don't know. But, there's some encouraging early reports out of India where some of the people that were vaccinated have had so far very low levels of breakthrough infection with what's been circulating so far. So really is suggesting, and they're using AstraZeneca plus another vaccine, Covaxin, which is their own, inactivated vaccine. But they're seeing not a lot of breakthroughs in people that have been vaccinated. Many of the cases are in people that are unvaccinated more than anything else. So I think it's at least relatively good signs that these vaccines are reasonable. But, this is something that's evolving by the day, and we'll likely get more information as the time comes.
Dr. Chagla says the best thing you can do right now is to get vaccinated when your time comes, especially with these variants circulating. He also says while it's not the time to panic, we may need people to quarantine longer after traveling to make sure that people from other areas of the world aren't coming into Canada with these variants. But we are learning tonight that many travelers aren't following the rules. The Public Health Agency of Canada says 733 tickets have been issued to people arriving in Canada without having booked government-authorized hotels and subsequently refusing to go to one. This fine for refusing to go is $3,000.